Welcome to HITshow, your go-to source for today's leading healthcare business headlines. I'm your host, Rhonda Brooks. It's Wednesday, October 8th. On today's HITshow, Sheba Medical Center launches a U.S. innovation accelerator in Boston. Mass General Brigham rolls out a plan to cut down on emergency department boarding, and a California hospital prepares to close its labor and delivery unit. After the break, RXNT debuts an AI-powered ambient listening tool that could save clinicians hours of charting time. Amazon brings pharmacy kiosks directly into One Medical clinics. And we'll finish with a bright spot focused on the next generation of healthcare workers. Let's get started. We're kicking off with a big move in the global health tech landscape. Sheba Medical Center is bringing its ARC accelerator model to Boston. But what exactly is ARC? And how can U.S. innovators plug in? Nate Collier joins us with the details.
Thanks, Rhonda. ARC stands for Accelerate, Redesign, Collaborate. It's Sheba's innovation arm, launched in 2019, designed to bridge clinicians, entrepreneurs, industry, and academia in health tech development. Sheba is establishing its first U.S.-based ARC accelerator in Boston, slated to start in January 2026. The ARC Boston soft landing pad will run 6 months, offering selected startups access to regulatory guidance, clinical validation, investment support, and non-dilutive pilot grants in Massachusetts. ARC already spans multiple global locations including London, Melbourne, Singapore, Berlin, and New Zealand, and has backed more than 100 startups so far. Among its portfolio are ADOC, a radiology AI vendor now deployed in over 1,400 hospitals, and MDClone, a data analytics and synthetic data platform startup.
Okay, so U.S. companies want in. How does this interplay work? Can U.S.-based startups apply directly or partner with Israeli ARC affiliates?
Good question. The Boston Accelerator is explicitly open to local and international health tech startups, meaning U.S. firms are eligible to apply. Selected U.S. companies will receive access to Sheba's physician network, pilot sites, and regulatory pathways. The idea is to bring solutions into real clinical settings, not just sandbox demonstrations. Also, U.S. innovators partnering with ARC in other regions may already tap into Sheba's mentorship and ecosystem. This Boston presence just lowers the friction barrier for U.S. engagement.
So U.S. firms could plug in without needing to relocate to Israel or elsewhere. That's a powerful lever. Thanks, Nate. Next up, if you've been anywhere near an emergency department lately, you know boarding is a growing nightmare. Patients wait hours, sometimes days, for an inpatient bed. Now, Massachusetts' largest health system says it's had enough. Teresa Vaughn is following the story.
That's right, Rhonda. Mass General Brigham is rolling out a new plan ahead of respiratory virus season to reduce ER boarding across its network. The approach blends short-term fixes and long-term changes, everything from flexible staffing pools to expanded observation units and even coordination with local rehab centers to free up discharge beds faster.
So this isn't just about moving patients through the ER more quickly. They're trying to redesign the whole flow, right?
Exactly. Hospital leaders say the bottleneck doesn't start in the ER. It starts when patients can't be discharged fast enough, which backs up the entire system. By opening new post-acute pathways and giving clinicians more flexibility, they hope to cut the chain reaction before it begins.
That makes sense. A true systems-level problem needs a systems-level fix. Thanks, Teresa. Now to California, where one community hospital is making a difficult decision. Peter Betterworth has the details.
Yes, Rhonda. Corona Regional Medical Center in Riverside County will close its labor and delivery unit at the end of January, citing sustained declines in birth rates and ongoing staffing challenges. The hospital says it's coordinating with nearby facilities to ensure continuity of maternity services. Still, the move highlights a concerning trend. Smaller hospitals, especially in suburban and rural areas, are scaling back OB services due to costs and workforce shortages.
That's an issue we've been tracking closely. Thanks, Peter. When we come back, an AI tool that promises to cut clinician documentation time by 70%, and it's launching at a price that could shake up the entire ambient tech market. Stay with us.
The countdown is on. Health 2025 hits Las Vegas in less than 2 weeks, bringing together the biggest names in digital health, AI, and innovation. This year's Workforce and Well-Being track dives into the leadership strategies, reshaping care delivery, retention, and culture. If you haven't registered yet, this is your chance to join the conversations shaping healthcare's next decade. Learn more and lock in your pass at HLTH.com.
Welcome back. You're listening to HITshow. Documentation overload continues to drive burnout, but one company says it's built a fix that's both powerful and affordable. Logan Stokes reports.
That's right, Rhonda. Maryland-based RXNT has unveiled Ambient IQ, a natively built AI ambient listening tool that captures and transcribes provider-patient conversations into structured clinical notes. Providers in early trials report a 70% reduction in after-hours charting. The software launches next month with a 3-month free trial, then just $75 a month, far below competing systems. CEO Randy Boldiga says RXNT's edge is that it's built into their existing EHR framework, meaning tighter integration and reliability.
That's a game-changer price point. Thanks, Logan. Next, Amazon's healthcare footprint is expanding again. Here's Anika ShahA.
Rhonda, Amazon Pharmacy will begin placing prescription kiosks inside select One Medical clinics this fall. The goal is to streamline medication pickup immediately after appointments, a move expected to drive convenience and brand loyalty. It's the latest step in Amazon's integration strategy, unifying primary care through One Medical, pharmacy through Amazon Pharmacy, and benefits through its digital health platform. Industry watchers say it could pressure retail competitors to follow suit.
I'm guessing this could ripple beyond One Medical's walls. Do local health systems see these kiosks as a threat, or maybe as a model they'll try to replicate?
That's already a conversation happening in several markets. Some hospital leaders see it as a competitive move that could draw prescription volume away from their own retail or specialty pharmacies. But others see potential partnership value, especially if Amazon's tech can simplify refill management or streamline prior authorization through integration.
Interesting. A classic case of disrupt or join them. Thanks, Anika. And finally, today's bright spot. Jalen Cross has the story.
CVS Health is investing in the next generation of healthcare workers. The company just opened its Workforce Innovation and Talent Center in Fort Worth, a no-cost training hub designed to build career pathways for students, veterans, and community members entering healthcare roles. The program combines classroom learning with on-site experience at CVS retail clinics and partner facilities. Leaders say it's part of a broader strategy to tackle national workforce shortages while strengthening community ties.
A refreshing example of corporate investment meeting community impact. Thanks, Jalen. That's all the time we have for today. Thank you for joining us on HITshow. If you liked these stories, please follow us on LinkedIn and check out our in-depth feature videos on HIT.show. HITshow, your go-to source for healthcare business news, can be found all the places where podcasts are heard. Please join us again tomorrow for the latest headlines in healthcare. HITshow is made possible by Kimchi. Transform your team with an agentic AI workforce that creates, optimizes, and distributes marketing content while keeping the human touch. For an AI workforce powered by you, Kimchi.com.